There we go. I think we're live now. We'll wait for a few people to hop on here.
Not much chatter yet. Say hello in the comments there if you're here. Let us know where you're watching from. Corey and Jerry.
Hi,
Tammy.
Hi, Tammy.
Tony. Debbie says hi from Colorado.
Kansas, from Kentucky, Arkansas. All right, everyone. We have a very special guest with us today. Dr. Allday is with us. He's from Lubrisyn, and we're going to talk about pet joint health care today.
And as always, leave your questions in the comments for Dr. Allday. He is here to answer all of them. Any questions that you have. At the end of this segment, we are going to give away a Lubrisyn HA Plus for MSM with the pet formula. We're going to give away 2 of those to 2 lucky winners. So be sure to say hello or leave a question. So you have a chance to win one of those. And also we want to mention that for the next 2 weeks, we have a promo going on. Right now you can get 20% off all Lubrisyn HA Pet and Equine for the next 2 weeks. And so with that, Dr. Allday, we will turn it over to you.
Okay. Well, osteoarthritis and taking care of your pet animals is really no different than, I mean, obviously I'm mainly and specifically an equine practitioner, and I work on racehorses. And because of the demands that they have, they sustain quite a bit of damage and or deterioration of joints, which is in the symptoms of osteoarthritis or the inflammation of that occurs when you have degenerative joint disease. Your small animals are basically the same situation. It's not nearly as rapid a deterioration because you're not going to, go out and make your dog or your cat. Mainly dogs is what we'll probably refer to, but cats, obviously all species or all pet animals can suffer from some form of osteoarthritis. And obviously, what you start seeing is symptomatically a change in their overall attitude and or habits as far as their movements, how they they can become lethargic. They can become very, very apprehensive to move across certain types of surfaces. One thing you'll see quite a bit is that as your animals, your pets get older, they tend to have a lot more difficulty. They don't metabolize like they used to. And so that, obviously the increased weight that can occur and decreased activity can essentially make your animal a lot heavier. And this puts a lot of stress on joints and can create and deteriorate the cartilage surfaces in the joints much, much more rapidly. And so what we're going to do is we're going to discuss just the overall process of what you can do to manage your arthritic animals, because the truth is all mammals, which humans, horses, giraffes, you name it, everything, including our dogs and cats, will suffer some form of osteoarthritis throughout their lives. Obviously, the fitter they are, we tend to see that they don't show it nearly as much. And I've always used a correlation that there's a high correlation between fitness and soundness, meaning that the fitter an animal stays, usually the sounder they'll stay too, because they've decreased their overall weight, they increase their activity, their range of motion, things of this tend to be a lot better and can be maintained much better if they keep the weight off, they burn the calories off, and they're a lot fitter, and they're able to go out and enjoy activities a lot more. The truth of the matter is that that's just not nearly practical unless you have a farm or something like this, or a place where your animals can get out in the backyard, or you can take them for long walks where they can burn off quite a few calories in a day. The overall overview is that osteoarthritis can affect any animals similarly to people. We get arthritis. You'll see you'll creak and pop, and you don't get up nearly as good out of bed as you did first thing in the morning as you get older. You tend to be a little stiff. Takes a little time to kind of warm up before you go down the stairs, or if you're, wherever it is that you're going to do activity wise. And as we get older, we tend to carry a few extra pounds, and all those things contribute to our, DJD or degenerative joint disease, and our animals similarly. It can be as mild as just a little stiffness and decrease in activity, maybe being a little bit change in attitude, to basically your animal being lame, meaning that they have an obvious deficit in a gait. They tend to usually be one leg at a time. You rarely see them be both, but eventually, like let's say animals with dysplastic hips, or they'll start off maybe being a little lame on one, having a hard time get up on one side, not so much on the other, and then eventually they're stiff on both of them. And you're thinking like, okay, so what do we do about this? Well, first thing you got to do is you got to realize that you have the problem. Number two, you might go ahead and utilize, obviously, a professional to get them diagnosed, meaning radiography, any other modality. Ultrasound is useful for time to time. And mostly osteoarthritis is probably best demonstrated by good radiology, good radiography. And what you're going to see is changes in these joints that shows that they are deteriorating the cartilaginous surface, and they're putting on a lot of exostosis or some bony or calcium in the area, and the range of motion is decreased. The animal is certainly a lot stiffer and sore, this sort of thing. So the obvious question here is, what do we do? Well, obviously, once you make the diagnosis and you've got it pinpointed as to what areas affected probably worse or the most, because it tends to be throughout as an animal ages that you're going to see a number of different areas. You're going to have some degeneration there. What we usually have to do is if it turns out to be the hips, we can address that with both some therapy, some medication, some anti-inflammatories, changes in diet, obviously, and then obviously activity. But there's a fine line between what is deteriorated, or will deteriorate the joints worse by being too heavy, and also what will be constructive or would help them become more and more comfortable so their quality of life can improve. So, you've got to look at things like let's say, for instance, some medications. I'm not a big fan of a lot of anti-inflammatories because they mainly just cover up symptoms and they don't do a lot for the joint itself. But like I said, one in particular that I will use in my my animals, because I have two Great Danes and I have regular visitors of a Frenchton, which is a Boston Terrier, and a French Bulldog, and a French Bulldog that my daughter has, the Kelly, and we monitor them routinely. But when these animals, like for instance, Zeus is 8-year-old Great Dane rescue, but actually both my Great Danes are rescues, and they will get a little stiff or sore. Murphy's only 3, so he's not showing a whole lot, but I'm very, very cognizant of their weight. Obviously, the heavier they are, the more stress we put on the hips, the more stress we put on other joints. And we'll see little things like they'll have difficulty getting up. They'll be a little funny going across a very, very slick hardwood floor, because they utilize the joints to try to stabilize their base so they can ambulate or move over that surface. And if they have pre-existing or developing osteoarthritis, obviously that is exaggerated, and the pain is increased quite a bit, like sometimes 2- and 3-fold over what it would have been when they were younger. So tramadol is my drug of choice. It is a synthetic narcotic. It doesn't have a lot of side effects. They all have some side effects, but it is something that you can get improvement right away. So we can at least keep them comfortable, keep them moving, and improve their quality of life. However, remember, these drugs are primarily, cover symptoms. They don't do a whole lot for the actual problem itself. So where do we address this? Well, there's obviously in the diet, you can go with things like I'm drawing a blank here, but let's say antioxidants. For instance, omega-3s, certain types of fatty acids are really, really useful. They will actually give you some improvement, and they will make them quite a bit more comfortable. Also, you want to try to cut out a lot of the fats. Certain things or diets, that can be exaggerating and create a lot more inflammatory type response, and have things of this nature that will create more and more and more difficulties. And you got to decrease the calories. You got to go ahead and go with things that, will have, you got to figure out what your caloric burn for your dog is. And we're talking about dogs specifically. And, basically evaluate where they are, get a weight on them, and then try to get a target weight to where your dog will get more and more comfortable. Obviously, I'm going to tell you about hyaluronic acid because I've made a living using hyaluronic acid, both on horses in particular, orally and injecting wise. And also, I've used it, obviously, my dogs all get it orally every day. I use because Zeus has some hip problems. Zeus is my older 8-year-old Harlequin rescue Dane, and he gets a little stiff, but he does get around pretty good, and he can jump on the bed. He can still, jump up in the truck, and he still stays fairly active. But I cognizantly watch his weight very, very closely, and I also look and see how much improvement I have in him as far as his activity. If he wants to go out, if he wants to go take a walk, if he wants to go down to the barn, if he wants to go down to the creek, and I'll let him go ahead and get out and walk along or trot alongside the gator when we take him for the walk. And Murphy does a lot of, he's the 3-year-old. He does a lot of loping or galloping, as big as he is, across the fields, and because Murphy weighs about 140 pounds, so he's a pretty good sized boy. But these guys, I want them to have a good quality of life. I want them to be fit. I want to enjoy activity with them, and I want to do things that they can do with me, because we have 80 acres, and I try to get them around as much of it. And Kimberly, my wife, does exactly the same. So we get these guys out and try to get them as comfortable as possible. Sometimes we will use a little bit of anti-inflammatories. Obviously, Previcox is high on our list as well. But remember, anti-inflammatory drugs in small animals have been developed for great symptoms. They will relieve the symptoms of inflammation quite nicely, but they do have a lot of side effects. They do affect a lot of tissues. They affect the kidneys. They affect the liver. They affect the gastrointestinal tract. And, you've got to be very, very cognizant of, if you give these things a lot and you get in the habit of using these things too routinely, you can create a lot of problems. So you should consult with your veterinarian, discuss possibly taking panels and or running some blood on them regularly, just to make sure that you're not creating liver damage, you're not getting a kidney problem. And there's certain ones that I try to stay away from completely, and that's like for instance, I'm not a big fan of Remedil. Remedil, the toxicity studies show that, it gives you great response, but the problem is it's got a tremendous amount of liver and kidney damage. And even in some individuals can have unbelievable bad side effects and can go into toxic episodes even with the smallest or only a few doses. So you got to be super aware of it. If you don't believe it, look up these drugs and look and see the toxicity studies on them. They'll amaze you because they're can be extremely dangerous. So you want to be super careful. The reason I like Lubrisyn in particular, or high molecular weight hyaluronic acid, is that it is in a healthy joint to start with. We supply it in a molecular weight that is mimics what's in a healthy joint, and it's easily administered on feed. Most dogs are very, if they're good eaters, they will take it in with their food quite readily and quite easily, and you will see a response in your dogs quite regularly. And the idea here is to increase their quality of life, increase their activity, help them burn calories off, and enjoy the relationship and or the camaraderie you have with your small animal, your pet. Well, I mean, they're not small in my case, but, with the two Danes, but we spend a lot of time together, and they go to the barn with me regularly, and when I'm getting my horses ready to go out and do things, if I'm on a rope or ride or whatever, they hang out with me, and they're they're my buds, and I really enjoy and spending time with them and take them with me, and they'll even go on a ride or a walk with me when I go to the arena and ride or get ready to warm them up before I rope and stuff. So these are just things that it improves their quality of life, and they it improves your relationship with them, and like I said, a Dane doesn't have the longest life expectancy, so you try to keep them as as happy and improving that quality of life as long as you can. And if anybody has any questions, you can feed them in here, and we can address whatever we can as we go along here.
Ashley had a question. She said, we have German Shepherds. Should I be giving them something early on to prevent or help, or should I wait until they show signs if they do?
Good, excellent question. It goes back to my credo. I am a firm believer in preventative medicine versus restorative medicine. The truth of the matter is, preventative medicine is probably the best way to help maintain your animal's quality of life, a much longer quality of life, to at least slow down, the pre-existing problems that like shepherds tend to have a lot of problems with hips and can have, generalized osteoarthritis. As a rule, the sooner you can get them on them, I recommend as soon as they can go on solid feed, I'd start then. My rescues, as soon as I got them, they were both pups. They were on Lubrisyn right away. It's the thing that's great about that is it has no contraindications in the medications that you would be on or anything else you want to use. It certainly has. We've done a ton of studies on it, toxicities. There are none with it. It is naturally occurring. HA is in all healthy joints in all mammals per se, and there's really nothing. There's no downside to it. In combination with great, like let's say your omega-3 fatty acids in your diets. Glucosamine and chondroitin can be added too. I'm not a big fan of it because a lot of studies say it doesn't really work that well. But PSGAG can be, like for instance, given as an injection. And there's a number of things you can do. But like you said, getting your animal fit, watching their weight, getting a routine, and keeping them, their overall weight and let's say their you hate to use a condition score because that's what we use in horses, but you really that's what you're doing. And when you get your animal to his target weight and that he's right there where he should be as far as his maximum activity, he's comfortable, he doesn't have to carry around a lot of extra baggage, you're going to see that they really want to play and do more things and run and exert themselves a lot more readily, and their quality of life is improved and they enjoy the accompaniment that they have with you as you do that. So the sooner that you can go with a preventative like a Lubrisyn, the better off you're going to be in the long run. And you'll improve your animal's immediate quality of life. You'll maintain joints, a much longer, healthier joint, and you'll see that they will you'll have a much more active relationship with your small animal, your pet, like I do with my guys.
Okay. Kenzie had commented that she says, my girl was diagnosed with severe hip dysplasia at 2.
Yep.
We do laser and underwater treadmill and are working hard to get her weight down. Last year, she ruptured her CCL and had TPLO surgery. I am trying to do all I can to support her joints and keep her comfortable.
Well, the problem you have there is that, that's a lot of deterioration. There's a fine line between what is constructive and destructive. Okay. And obviously, I think Aqua Therapy is excellent. And the reason why is because you get range of motion, you keep them, you burn calories, they stay, it muscular, but you don't have the loading. So therefore, you won't put as much pressure on, the stifles, where you would have, deterioration of the meniscus and the ACLs and the collateral ligaments, the medial and lateral collateral ligaments. And so therefore, using Aqua Therapy, using laser, and using some of these other modalities for therapy are beneficial, along with utilization of Lubrisyn and or the diet, say the omega-3s and things like this, the antioxidants that are all beneficial to help decrease the buildup of a lot of toxins and or inflammatory products in the joint as well. And by doing that, you will stop that production. But and again, you'll improve the quality and or the health of those those structures by improving the hyaluronic acid content in those joints as well. So there's a double benefit. Not only does it help the range of motion, decrease inflammation and all, but it also helps maintain the quality of the structures and the health of those structures, because I use this term a lot, but I consider that the life's blood of a joint is the synovial fluid, and the higher quality of the synovial fluid, the higher content the HA content is in that joint.
I think you touched on this a little bit in the first question, but Tammy asked, is there a certain age in which you should wait until the animal becomes before giving it a joint supplement?
Well, here's the deal. I mean, depending on the breed, okay. Like for instance, toy breeds, we see a lot of patellar subluxations. All right. We have seen studies, and we've done studies with some practices that have shown tremendous improvement, that the earlier that they get on a Lubrisyn, in particular, a high molecular weight HA, they will decrease the arthritis and or the subluxation. So these animals it improves their quality of life quite readily, because there's quite a bit of median collateral ligament and patellar ligament damage that's done by the subluxation. And I claim no originality, but I've learned this from a couple of veterinarians that basically got feedback to me that said, hey man, I've been putting toy breeds on this stuff, and it is totally turned around subluxation cases. Even the ones that have been addressed surgically said, man, they recover faster, they're much more active, and they stay sounder longer when I leave them on the Lubrisyn. So we have great response with it from a number of people across the country that have tried it. And now the word's gotten out. A lot of people it's kind of like not a best kept secret anymore, but a lot of people know about it for sure.
Okay. Kenra, she commented that she has an active German Shepherd, and she is curious food wise and what type of supplements do you recommend as her dog ages?
Well, obviously, anything that's going to keep them, give them plenty of energy, rebuild structures. I mean, we we kill our animals with kindness a little bit too much. We get them way too much food. Unfortunately, they get heavy. We don't, by the time that you realize that your animal is like pushing on the limits of obesity, the problem is that, they can't get around very good. And it's like darn near impossible to get that weight off because they're so uncomfortable. You can't get the activity, and you can't really starve them, because the problem is, you can create, quite a bit of problem by not having them on any kind of a normal diet. So, what I tend to do is I will replace. You got to be careful, because too much protein and can be really difficult on kidneys in particular, because that is the filtering system that takes a lot of nitrogenous waste out to start with. But what you've got to do is you need to go with high quality digestible proteins that don't have a lot of non-protein nitrogen in them. And then you need to go with, let's say, again, without doubt, a lot of the omega-3 fatty acids, and then decreasing the overall caloric content and being careful not to put a lot of other things, scraps, whatever. And one of the best things you can do is, if you can get this animal to swim, you can improve their cardiovascular and respiratory cardiopulmonary fitness, but not have the pounding and the soft tissue structure, and the arthritis gets exacerbated by trying to get, burn those calories off on a really heavily obese animal. And so that's one way to do it, or an aqua tread, obviously, because you still utilize some of the buoyancy, but you still put a little bit of loading on these things, so you still get some response for the muscle, things like this. So the diet is paramount. Obviously, you've got to be super, cognizant that, restriction of food intake and or calories. I know it's difficult, and we tend to be our animals' like worst enemy, because we kill them with kindness. We overfeed them, and we get them extremely heavy. And you've just really got to bite the bullet. I know it's difficult, and we want to give them treats. I give my dogs bones at night and that sort of thing, but I do try to keep my guys really fit. It's really important to me, and I keep a regularly. We in my warehouse, so I've got an electronic scale. I'll walk them across it regularly, and if I start seeing, 5, 8, 10% change in body weight, which it never happens, but I'm doing a little bit. I'm going extreme here, but I'll automatically try to increase their activity a little bit and decrease their caloric intake, and try to keep them fit as possible, and to give them a little bit more time of walking with me and going outside, and then cutting back on some of the treats, some of the bones that we give them at night. We do that routinely. We try to give them healthy stuff, but we still, like I said, they're getting the routine, and they like it. And those calories build up over, week in, week out, month in, month out. And then next thing I look over, and Murphy doesn't weigh 140 pounds. He weighs 150 pounds now, so I got to be super careful. And Zeus, same thing. He's a little bit more hip dysplastic and shown some problems, but he stays reasonably sound, and we still keep his, really watch his weight closely. And I only use a little bit it's some of the anti-inflammatories like the tramadol or the Previcox, but things like this that you've got to utilize, very transiently, not chronically. Don't use it all the time, because you will pay a price for that. But give them that so that you can improve their activity, and then get them on the Lubrisyn and get them moving, and increase their antioxidants in their diet and things like this, and then try to conscientiously remember that hey, like Zeus he's 8 years old now, and and that's a senior Dane. I mean, he's getting toward the end of his life, so I want to try to get as much activity and quality of life, and improve his overall fitness as I can, as quickly or as rapidly as I can, to keep that weight off.
All right. Don had a question, and he asked, can you give a dog an OTC anti-inflammatory on a daily basis?
Okay, OTC like a human? Is that what they're referring to?
I don't know.
I'm not
All right.
sure.
Look, I don't
Don, if you're
recommend,
still on, confirm for us.
Yeah, I don't know.
I don't recommend it because the anti-inflammatories that were developed for people are extremely toxic to the kidney and liver and tissues, gastrointestinal, can create ulceration, things like this. And another thing we also, I'll share with you is that if you chronically use anti-inflammatories, you're going to see that a lot of things, it'll be tough on their kidneys. They'll build up a lot of nitrogenous waste, and they'll become, they'll get gastrointestinal ulceration. And that's another thing Lubrisyn has been scientifically proven to help heal is gastrointestinal ulceration. So you get a double benefit there, but not that I'm going to push that for small animals, because we use it in horses for that purpose too. But the truth of the matter is, it is certainly going to give you an improvement in your animal's activity, his quality of life, and the range of motion and the function of his joints. So therefore, they're going to want to go out and do more and feel better. And with discretionary use of anti-inflammatories, when you have overactivity, or if your dog does a little too much, use that that discretion to give them some anti-inflammatories to try to get them back into their normal activity as rapidly as possible.
Okay. Nikki says that she has a standard doxy and a mini. What is the best maintenance Lubrisyn dose that they should get?
They would get a standard. Okay, say that again. What were the two?
She said a standard doxy and a mini.
Okay, they would probably need about, to start with, a loading dose would be 10 cc's or 2 teaspoons, and they should maintain on a teaspoon or 5 mLs a day, maybe 7.5, like which would be like half a tablespoon, and that would probably get it. Depends on dogs, as we found, have a much higher metabolism than one is that, you've got to kind of play with it a little bit, but I'd say somewhere between starting off on 2 teaspoons and back to a teaspoon a day for both of them should be more than enough, should be good if they weigh between, let's say, the 10, 12, 15 pound range.
All right. Kenzie said, I currently use Wilactin, Dasaquin, and Movoflex for my lab Libby.
Yep.
And can hyaluronic acid work in conjunction with these?
Yes, most definitely. The thing you got to remember about the hyaluronic acid that we make is that it is hydrated. It's a hydrated, high molecular weight HA. That the key to that, and the importance of that, is that it takes somewhere in the order of about 24 to 36 hours to drive the raw material into solution, and the normal transit period in the GI tract of a small animal, a dog, is much shorter than that. So if you can convince yourself that you can give a powder, like a powdered HA, and it can be hydrated and absorbed, it doesn't work that way. We've done the hard part for you. We've gotten the high molecular weight, high quality HA that's in solution, that's going to be absorbed right away and go right to the joints. And that's the idea behind using this. Yes, it does work great, and it works in conjunction with these other medications quite nicely. In fact, I would say, if you're having great response with those others, you'll see even a better synergistic response by using Lubrisyn HA with those medications or those supplements as well.
Okay. Charles says, I have an 8, almost 9-year-old Labradoodle who had Lyme disease. She gets stiff in her hips and she limps at times. What would be best for her?
Well, Lyme disease is a degenerative arthritis. Once it starts, it is progressive, and you will go through episodes. Anti-inflammatories have to be utilized to get them comfortable on a very judicious basis. Tramadol would be the mainly mine would be the one I'd probably recommend, mainly because you don't have a lot of secondary side effects. It doesn't hurt a lot of tissues. You still got to be judicious with it. You got to be careful because it can be so, it being that it is a very, very good anti-inflammatory and analgesic, they can do damage to things that already have pre-existing problems or deterioration. So it makes them feel really good, and they'll overdo it right away. Obviously, you know, the building blocks, you know, of the joints obviously would be important. The omega-3s, you know, the antioxidants that would be important as well. A good protein in the diet, you know, without too much, and then obviously, you know, but HA for sure, you know, is going to help the quality of the fluid in the joints. A hydrated form of it is obviously the best, and the higher molecular weight you can get. We do, you know, Lubrisyn does have the highest molecular weight HA on the market. So, you know, you pay a little more for it, but you get a lot more out of it. So that's the key. You know, it's kind of like everything in life. You get what you pay for.
Corey had a question. She said, my border collie is extremely active, but have noticed her stiff the first few steps when she gets up. She's 5 now. Have I waited too long to start her on Lubrisyn?
Well, you haven't waited too long, but it would have been better if you started earlier. You wouldn't have probably seen that. You need to get on it and then go on the loading dose. You know, a typical border collie, especially it's a female, she probably weighs between like 35, 40 pounds, I would think, if she's a 5-year-old, unless she's gotten very, very heavy. And then obviously you're going to need to, like, you know, as she improves or increases her activity, you're going to need to go ahead and really, really monitor her feed intake and try to keep her weight down so you can maximize her activity level without deteriorating or destroying, you know, by, you know, too much activity, the joints that have been affected. Obviously, you know, I mean, it's a normal senility change. It's part of the aging process, the degenerative joint disease in the form of osteoarthritis. So the quicker that you can improve, you know, the range of motion and the functionality of those joints, the quicker they'll be back to their normal activity. If they're stiff, that's obviously they're showing some early signs of it. Once you've been on it like a week, 10 days, even 2 weeks, you should see that they shouldn't be as stiff. So that's the key. And then improving her, you know, like I said, goes back to what we spoke about originally, and that's there's a high correlation between fitness and soundness. So work at getting her weight down, getting her fitter, and you're going to notice that she's going to stay sounder and fitter if you do that. If you can get her to swim, a lot of my border collies I had in the past, they love to swim. I had one who would go jump in a pool and swim himself, and he'd do it in the summertime to cool off, but he loved to swim, and it kept him around till he was 16. I mean, he was on Lubrisyn every day of his life. So, and he was right when I first started making it, his name was Pete. Anyway, I got him in California, but right when I started making Lubrisyn, I put him on it, and he stayed on it all his life and lived a very, very healthy, active life for quite some time.
Kenzie asks, how long do you give loading doses, and is the first time a 1 day or 2?
Typically, you'll give a double dose once a day on a loading dose. I like to give that for at least a week, sometimes as long as 2 weeks, 10 days to kind of be the interim in between. And then you get them back to their regular maintenance dose. If it's an active dog or a performing dog or a herding dog or something like this that you're going to use for, let's say, competition, something like this, I'll double them up like over a weekend when I know they're going to get used real hard. And I recommend that as well. I do the same thing with my horses. I do it with my dogs as well. If I know they're going to be really, really busy and do a lot, you know, it certainly will help them build up, like going into a big weekend, if they're going to do a lot of herding or a lot of, let's say, field trials, something of this nature. Double them up for 3 or 4 days before, and then give it to them a double dose through the weekend. And you'll see that they'll perform better and recover better if you do it that way.
Shirley asked if the product is different for animals than the human formula.
Well, actually, humans do metabolize humans have 20% more. The human product has 20% more in it. Okay. So, and dogs, by virtue of their weight, okay, they metabolize more than a horse does. Okay. Because, for their size, a dog is probably metabolizes more than anything, any of the animals. But bottom line is that, for the, number, milligrams per pound, the dog has the highest demand level. So, we tend to, like I said, if you look at it, I mean, up to, like, my guys get like a full ounce, 30 cc's, 30 to load and then 15 to maintain. But I mean, that's the same size as a horse, and they need it because, like I said, if they don't get it, I can see it right away. That they're like I said, if every now and then, they forget to put it on their feet or something like that, and I can see Zeus right away because he's got hips. When his hips are bugging him, he gets stiff and he has a hard time getting up on. We have a big sectional couch, and he lays up there with me all the time. Yeah, I know. I mean, it's for the dogs. I mean, I tell you, it's mine. It's for them. But the bottom line is that when he gets up, I mean, I watch him, and when he's stiff, and I say, hey, so I forget to put the Lubrisyn in him, because he can get up and down great when he's on it, and sometimes he gets a little stiff, so somebody forgot.
Molly had a question. I'm going to see if I can pop that up there. She said, I know you mentioned you weren't the biggest fan of glucosamine Ronathan or whatever that is, and it doesn't do much. Is there any research that shows taking it every day for long periods of time that it can be beneficial, or is it kind of a waste?
Well, the jury's out, in my opinion, but look, I gave so much of it, like ad nauseum, like you would, like more than, I can't tell you how much I gave, and I never really saw much improvement. Went a different direction. That's why I went with an oral HA. I injected joints, and that you can do that too. But if you had your choice between injecting a joint and or put them on oral HA, I highly recommend the route of administration orally, safer, less complications, less problems, less chance of getting an infection, and less chance of having a reaction from the injection. So, my experience was that I just didn't get the results I was looking for to get my animals sound, horses, dogs, anything. And so I went with oral HA. And when I did that, I started seeing a decided difference. So until someone can show me that it doesn't work or something works better, that's my story, and I'm sticking to it. I'm going to keep using that Lubrisyn high molecular weight hydrated HA.
Corey has a question. How do you know which Lubrisyn formulation to choose?
Good question. Excellent question, actually. What I do is, if you've got, like, for instance, the gal that said her 5-year-old border collie, that would be a perfect example of an animal is getting a little stiff. They probably have an ongoing osteoarthritic episode, possibly shoulders, possibly stifles, possibly hips, or a combination thereof, maybe even in the carpus. I would go with the MSM or the Plus, because MSM is a very, very good natural anti-inflammatory, and it would give you you can definitely tell the difference, because I put Zeus on the MSM and he's a little slow to respond to the straight HA, Lubrisyn HA. When I've started a young dog on it as a pup, and typically I find that I don't have to go to the MSM until they get overtly arthritic, that you can obviously see, and then I'll switch them over to the MSM. But that's usually at the end, at the end of their activity career. Typically, if I leave them on the regular Lubrisyn HA, they do just quite nicely, quite fine, stay really active, and they're earlier the better. As soon as they go on solid feed, I recommend you go on it, because you're going to see. It's very, very good for, a lot of, I've used it in a number of different osteoarthritis and or metabolic diseases, and I've had great response with it. And that goes back to osteitis, and a number of things. There's a lot of factors that HA is a naturally occurring substance. It's in all the tissues in your body and in joints. It's in your eyes. It's in a number of things. And it's been my experience that the pan-osteitis dogs seem to respond really great to it. And, it's been shown that it improves bone density in osteoporotic animals and in people as well. So, there's a lot of application of this mainly for joints, but there's a lot of tissues in the body that use this as well. Obviously, I think it improves your skin. I improves skin healing. I think it probably helps hot spots, to some extent. And we do make the, our Lubrisyn wound gel, and we have great success with it on broken skin, having those things heal up right away and getting those things healed up and comfortable and not being hot and irritated and itchy and scratching and this sort of thing right away. So, and it has HA in it as well. So there's a lot of things, applications for it, and a lot of things that you can use, both topical and or the oral, to get improvement for your dog's quality of life.
All right. Donna said, I have a 7-year-old border collie who is obese and can hardly walk, mostly front legs. Would this help, and how much is acceptable?
Yeah, it'll help. But I mean, obviously, the first thing you're going to need to do also is you might need to pull some blood. You might want to check your dog's thyroid, make sure you're not hypothyroid. That may need to be supplemented. If it is, Lubrisyn is not going to affect that at all. It's not contraindicated in that case, or in any for that, as far as medications are concerned. You've got to break the cycle. Okay. It's difficult. If you can go to an Aqua Tread, okay, you won't have the loading, and, you'll get some buoyancy because fat is very buoyant. I mean, and you'll notice, like, if you look out in the water, fat people float really easy. So, if you go to the pool, if you go to the salt water, so your dog will float really easy too. But you need to do something to improve their activity level, and the more you do, the better they get. So, once you make that plunge and you take that first, activity, to get them in, an Aqua Tread, they'll start getting fitter, and you want to be careful about these really, really obese, active dogs, like, for instance, a border collie, because that's when you can blow ACLs and collateral ligaments and things, this nature in the stifles, and you can, put a lot of pressure on these animals, as you try to improve or increase their activity. So, cutting back on their feet is paramount, and trying to gradually improve their quality of exercise and or amount of exercise, so they burn more calories, and decreasing the amount of calories gradually and increasing activity to where this animal starts to get more and more comfortable is the key to the success of, getting your animal back to more of an semblance of normalcy, and or improving their quality of life, so they can still have some sort of quality of life, without basically being so uncomfortable they can't move.
Susan has a question. She said, I have a 2.5-year-old lab pit mix. Her left hind kneecap is coming out of joint. She needs surgery, but was told to start her on joint supplements. What would you suggest? She's 72 pounds.
Yeah. This is another example of a subluxation, and we've had tremendous success with it. You're gonna still have to have the surgery, but it will improve the response from the surgery, and staying on it afterward will help the surgery heal much quicker, and you get your animal back to being normal much, much faster. We've seen, great success with it, post-surgically on a number of cases over the years, and we've had great success we're getting these animals back to, improving their quality of life and giving them back to at least some sort of a semblance of a normal activity where you can still enjoy your animal and still have them to where they're not just a couch potato, or they don't they can only just be around the house. They can get out, get around the yard, go walk around the neighborhood, and that kind of thing. So yes, going on the anti-inflammatories at a low level, going on the antioxidants, changing that diet, decreasing their calories, and then trying to maintain them, and then try to get them on a diet that basically is get a good caloric burn, getting that weight off, and that's going to take time. It's not going to happen overnight. And then looking at things like aquatred and or swimming and things of this nature too. So all these things will add up to try to getting your animal fitter, maintaining them sounder, and then also improving their quality of life by the virtue of doing those two activities.
Okay, we did have a few questions on here about horses, if you don't mind.
Oh boy, my favorite subject. Besides my dogs.
Okay, let me back up here and see if I can find some. Jana asked, she was wondering what the dosage would be for an 1,100-pound gelding to help his aging joints. She said he's almost 24 years old now. She rides him several times a week, and mostly indoors in an arena.
Okay. Well, obviously he's got some activity going on, so that's good. I would start him off on, a 30 cc's a day, and then seeing how, for at least a week to 10 days, maybe as long as 2 weeks. Once he looks like he's showing you the response that you're looking for, where he's not nearly as stiff, he warms up quicker, this kind of thing. And then obviously, with an older horse, you got to have a very, very regimented routine. And what I mean is that when you come out and, you saddle him up, or if you ride bareback, whatever you do, essentially getting him out and let him walk and free up and give him plenty of warm up before you do any kind of, extra or increased movement. And I'm talking about like 15, 20 minutes of walking. And then you can basically start bending them, basically use your legs on them and basically bend them to where they can, it supples their spine up. It makes them use their head, and it makes them drive up underneath, and it frees up their hind end as well. And then essentially, once you've gone through this and this gets to be part of their normal routine, then you can go ahead and start trotting them and or cantering them too, both directions, obviously, so you can use both sides and get them comfortable. But this is what I'm describing is exactly what I do with my rope horses when I get them out. I'll get them out and I'll walk them for an extended period of time. Then I'll long trot, both directions. Then I'll go ahead and canter both directions. And then make sure, by the time I've warmed my rope horse up, he's already been out there a half hour, 45 minutes before we even think about roping. Okay. So, he's an athlete. You got to treat him as such. And, they all have some wear and tear, pre-existing things. And so therefore, and my rope horses are all on Lubrisyn, and, getting them comfortable and getting them to where they're, they're freed up. They're very supple. They'll bend both directions, and, you ready once they get this good warm up. And I mean, I like to have my horses break, starting to break in a little bit of a sweat. So, that they're really warmed up. The large muscle groups over the shoulders, the backs, the hips, and the hamstrings, and the gaskins, and the lower, the thighs of the horse. These are huge muscle groups, and they require a lot of warming up before you go out and use them. So you got to be careful. This is how horses strain things and can pull things. And obviously going to get you a setback because that's going to basically create inflammation and or swelling and or soreness and or lameness. So you want to do all these things to try to maintain them, to get them as, happy, healthy, warmed up, and ready to do a physical activity. Because like I said, in my particular case, my rope horses are 9, 10, 11, 12 years old. So therefore they need the warm up in order to be the best they can be and be comfortable so they can go do their job right.
All right. Carrie had a question. She said, I have a mare with big knee on one side and a bone spur on the other knee.
Mm-hmm.
Have had her on this for a few months. Should this help stop the knee growth?
Well, you're going to notice that if you were to take a radiograph, the growth of the knee, okay, or the enlargement of the capsule, the actual joint capsule is extra articular, okay, mainly. There'll be some bony changes, but a lot of it is soft tissue that will become ossified because it's been traumatized and it may have been injected or whatever. But yes, it will if you decrease it to some extent if you increase the range of motion and or get this horse out moving regularly. But if it's already got calcium deposits in that capsule, it's not going to really bring it down in size very much. I think you're going to be more impressed with the range of motion and the ability of the horse to go out and do his job, to a higher degree. But the bottom line is that, really what you're looking for is the amount of activity. And, aesthetics obviously, are important. I mean, the way things look obviously is going to make a huge difference. But, I'm a firm believer that pretty is pretty does. And I like them to go out and do their job. I mean, they're going to get wear and tear. They're going to have, joint stuff. They're going to get tendons like boggy hocks and or, fluid down in the lower limbs, things like this. And, but as long as they're increase their activity, they're comfortable and they're able to go out and do their job, I think that their quality of life is better, that their ability to perform is better. And, I think it's really more of an indication of what they can and want to do for you and with you than it is what it looks like, the aesthetics or how it looks. So, that's just my take on it. I mean, some people, look at it totally different, that you'd like to, we'd all love for them to be clean legged, but it doesn't always mean that's going to be the case here, bottom line is that, if you want to inject the horse to get that capsule down, yes, they can probably respond as long as there's not a lot of calcium or exostosis around a joint. But, really the improved activity and range of motion is really more paramount and actually much more important for the overall health of the horse and his ability to go out and do his job and improve his quality of life and his ability to go out and ambulate and get over the ground better. So I'd be more focused on, how the horse is moving than I would how it looks is what it comes down to.
Okay. Donna had asked at the bottom here, is HA prescription only?
No, not at all. If you inject it, it is. I mean, only a veterinarian can do that. But oral HA is over the counter. You can buy it, tack stores, feed stores, online, whatever. And if you're going to use an HA product, I recommend you get ours because you want the highest quality and the best quality HA, and the highest molecular weight that you can get. And that's that. I just described Lubrisyn HA for you.
Maya says that she has a 9-year-old quarter horse mare with a 2-year-old stifle injury, and she's wondering what would be best for her.
And see, in this case, it depends on what the injury is. Was it soft tissue? Was it bony? Was it ligamentous? Was it, I mean, there's so many different things. Like, for instance, meniscal injuries in horses are pretty serious, and they can be, the career ending. So it just depends on, the degree, the severity, and what was involved. If it was bony, if it was an OCD, there's a lot of ways to approach this. So I think we need a little more detail on that. At least I would need more detail to give you a better response, or that would be helpful to you. So if you can get more information, send it in. I'll darn sure. And if you don't get it back in this, go to the website, Lubrisyn.com, and send, or ask a question, and I'll get back to you directly, or somebody will reach out to you, but it'll probably be me, and see if we can't brainstorm this. And worst comes to worst, you can always call them. Like, we can try to see if we can help you, get you in the right path.
Tony had a question. He said, my current joint supplement does not contain HA, so I understand that I may not be getting the benefit I need, ? So I think he wants just reassurance on that. And also, he said, do you ever notice appetite changes due to joint issues?
Oh, absolutely. No. I mean, you're going to see joint issues cause discomfort, pain, lack of mobility. They can be depressed. They can be, I mean, when a horse is sore and they're uncomfortable, tremendous change in attitude, outward. They're not nearly as, they're not nearly as congenial. They're not nearly as happy. They're not nearly as comfortable. And you see it right away. I can tell right away when a horse is uncomfortable. I've made a living doing it for 35 years on the racetrack. So when a horse is uncomfortable, he's people used to always tell me, says, boy, wouldn't it be great if they could just talk to you? I said, what I used to always say, because I learned it from someone that was much more learned than I am. I said, I think they actually do talk. It's just learn how to speak their language and reading what they're telling us. And, what he's describing is what his horse is telling him. Okay. That he's uncomfortable, that he's not happy, that he's a little depressed, because he's not the same, happy-go-lucky, comfortable guy that he used to see every day of the week. And, yes, most definitely, they will show outward signs of being uncomfortable, and you can read it right away. At least I can. I like I said, I've made a living doing that in particular.
Cool. Ashley had asked if the feed through works close to the same as an injection.
In all truth, no. It's not nearly as quick. It doesn't. It just doesn't give you that immediate response. When you inject, you do two things. You put a high molecular weight HA in there in a large concentration, and it usually added. You give a blast of anti-inflammatories to decrease any sort of flare that you might have, with the immune system. And also, we tend to put some corticosteroid in there. Truthfully, nothing works symptomatically better than a corticosteroid in a joint. But the problem is that with time, the joint becomes refractory, meaning it doesn't respond as well. And number two, one of the side effects, one of the bad parts of using corticosteroids in a joint is that immediately gives you a great anti-inflammatory, but once that anti-inflammatory effect has been dissipated and that part of the molecule is gone, it becomes catabolic, or it breaks down tissue, and so therefore it can become destructive and or deteriorate the joint. So bottom line is, this is why they become refractory, don't respond as well to subsequent injections with corticosteroids in the acid. So okay, if you're looking for immediate, relief, yes, joint injections for sure. I can tell you for a fact, I've done probably, I can't tell you how many hundreds of thousands of joints I've probably done. But the bottom line is, if you want to maintain this joint, probably the route that's the safest and delivers the best results with the least risk and or, pardon me, problem associated with it would be using an oral supplement of high molecular weight hydrated HA, i.e. Lubrisyn HA.
Okay. Kenzie asks, is it safe to assume that it will also help the back and the spine?
Well, yeah, because I mean the tissues in between, the cushioning between the vertebra is high in HA. Okay, now it's not gonna an animal that has tremendous discospondylitis, it's not going to make much of a difference there, but it'll make some difference because this is hydrophilic. It goes in there, it helps the natural HA in there, and it actually makes moisture come into that, so it tends to make that tissue a lot more spongy, a lot more a lot more comfortable to the animal. Yeah, with time it will definitely improve it for sure. Okay, is it going to change a severely discospondylitic animal? Probably not. But early on, that with a minimal amount of body changes, yes, it could make a huge difference. Yes.
Okay. All right, Mel, did you see any other questions? Have we missed anything?
I don't think so. If you guys have any more questions, go ahead, leave them in the comments, and we'll work with Dr. Allday to get them answered for you. So
yes, and thank you, Dr. Allday, so much for answering all these questions for us.
My pleasure.
I just realized that we were on here for an hour, and it didn't seem like that.
Well, I didn't even notice, but that's great. Listen, you guys are great. Really enjoyed working with you. And anytime we can help out, our favorite subject is, how we can help animals. So.
Thank you so much. All right, Mel, let's have those winners.
all right. So we're giving away 2 Lubrisyn
HA
Okay.
with MSM pet formula.
Yes. Okay. So our first winner is going to be Molly Hain.
Woo! Congrats, Molly.
And our second winner is going to be Donna Robertson. So,
hey, Donna.
Yay! Congratulations.
Congratulations. If you guys heard your name, go ahead and send a PM and to claim your prize, and we'll get the information we need there.
And don't forget that right now for the next 2 weeks, we have 20% off all Lubrisyn HA Pet and Equine formula. So this is a fantastic time to take advantage, to try it out if you haven't already, or stock up. So take advantage of that.
And we will be back on here on Tuesday. We will be back on with Easy Care, so make sure you join us then, and we'll be talking about a brand new boot.
Yes. All right. So, once again, thank you so much, Dr. Allday.
Thank you. You guys have a great day. Take care.
You too.
Thank you very much.
Bye-bye.
Bye, everybody.
Bye.